Hello guys, welcome to another anatomy tutorial. In this tutorial I will go over rotator cuff muscles and teres major. Although teres major is not one of the rotator cuff muscles, I will explain in a minute why I include or group them. Rotator cuff muscles are 4 in number: supraspinatus, infraspinatus, teres minor, and subscapularis. The primary function of all rotator cuff muscles is to stabilize shoulder joint by holding the humeral head into the glenoid cavity. Shoulder joint is the most mobile joint in the human body, and because of that, it is very susceptible for translation or dislocation. And rotator cuff muscles are a group of muscles that prevent those kind of translation or dislocation. Supraspinatus originate from the by the way, I took those pictures from the Wikipedia and I will add the link in the description below. Supraspinatus originate from the supraspinous fossa. This is the spine of the scapula. We are looking at the posterior view of the shoulder. So this is the spine of the scapula, and supraspinous fossa is superior to, as the name suggests, to the spine of the scapula. This is the reference point. The spine of the scapula is the reference point. And inferior to that is infraspinous fossa. So supraspinatus originates superior supraspinous fossa, and it inserts to the superior aspect or superior facade of the greater tubercle. As I said, the primary function is to hold the humeral head into the glenoid cavity. In addition to that, supraspinatus initiate abduction up to 15 degrees, and it also prevents inferior translation. It is innervated by the suprascapular nerve, spinal cord segment C5, C6, and if you can recall it, if you have watched my brachial plexus tutorial, we have seen that the suprascapular nerve is one of the short branches that come off from the superior trunk. Infraspinatus originate from the infraspinatus fossa, here, right here, inferior to the spine of the scapula or dorsal aspect of the scapula, and it attaches to the middle facade of the greater tubercle. It holds the humeral head. As I said before, all the rotator cuff muscles hold the humeral head into the glenoid cavity. But in addition to that, infraspinatus externally rotate the arm at glenohumeral joint or shoulder joint. It is also supplied by suprascapular nerve, spinal cord segment C5, C6. It is the same nerve that supplies supraspinatus. Teres minor. Teres minor also originate the dorsal surface of the superior half of lateral border of the scapula, right here. So it is inferior to where infraspinatus originate. Infraspinatus originate this flat area, but this is where, inferior to that is where teres minor originate, and it attached to the inferior facade of the greater tubercle. In addition to holding glenohumeral cavity, in addition to holding the humeral head into the glenoid cavity, it laterally rotates the arm at glenohumeral joint or the shoulder joint. In fact, it is one of the most powerful lateral rotator muscle of the arm. It is innervated by axillary nerve, spinal cord segment C5, C6. Axillary nerve arises from or branches off from the posterior cord. It's one of the short branches that comes off from the posterior cord of brachial plexus. Lastly, subscapularis. Now we're looking for the anterior view of the skeleton of the shoulder and thoracic wall. It originates the costal aspect or internal surface of the scapula or subscapular fossa, known as subscapular fossa, and it inserts the lesser tubercle of humerus. In addition to stabilizing the shoulder joint, it internally rotates or medially rotates the arm. It's not the only medial rotator. We will see in a later tutorial. Latissimus dorsi and pectoralis major also medially rotate the arm. It is innervated by upper and lower subscapular nerve, spinal cord segment C5, C6, C7, and both nerves are short branches of the posterior cord of brachial plexus, similar to axillary nerve. I have said that I will explain why I include teres major in this group of muscles, even though teres major is not one of the rotator cuff muscles. If you have watched my brachial plexus tutorial, I have said that in each tutorial I will focus and explain a group of muscles that are related. Either they are innervated by the same nerve, or they perform the same action, or they are anatomically related, meaning they have common insertion point, or they originate the same area or an area that's close. In this case, teres major, as you can see, it also originates from the dorsal aspect of the scapular. So that's why I group them. There's a group of muscles that originate, most of them, Supraspinatus, Infraspinatus, and teres minor, the posterior aspect of the dorsal or posterior aspect of the scapula. So that's why they're anatomically related. They're also functionally related, as we'll see. So teres major, again, is not one of the rotator cuff muscles. It originates the posterior aspect of the inferior angle of the scapular, as you can see here. This is the inferior angle of the scapular, and it attaches the medial lip of intertubercular groove of humerus, the medial lip. Lateral lip is where pectoralis major, we'll see another tutorial, inserts, and in between them latissimus dorsi inserts. It abductus, it adductus internally rotates and extends the humerus from flexed position. It's innervated by the lower subscapular nerve. If you can recall, spinal cord segment C5, C6, if you can recall, we have said that lower subscapular nerve innervates subscapularis and teres major. So now you can see here, it innervates teres major as well. That's that for this tutorial. See you in the next tutorial, and be sure to subscribe the channel. See you soon.